Hey, what's up you guys? So today I just finished my infectious diseases rotation and I would like to share what I learned in that rotation in a very quick summarized video. So first, let's talk about sepsis, septic shock. If somebody presented with septic shock or sepsis, what do we do? The first thing, the first broad spectrum antibiotic, we need to cover gram-positive and gram-negative. So what we do, Vanco for gram-positive, vancomycin for gram-positive, and we have Zosyn for gram-negative plus the anaerobes and anaerobes. So vancomycin plus Zosyn. Vancomycin for gram-positive, Zosyn for gram-negative and anaerobes. Okay, so this pretty much covered everything. What if the patient didn't respond to vancomycin plus Zosyn? Then in this case there are two options. Either there is vancomycin resistant enterococci, like they're resistant to enterococci. In this case we give daptomycin. Or if there is, like, based on the culture, or if there is extended spectrum beta-lactam, these are resistant to Zosyn. So what do we give for that? We give meropenem. So in this case, daptomycin plus meropenem covers everything. Or you can just do vancomycin plus meropenem. This will cover almost everything. Because sometimes if the patient is not improving within 24 hours, then we do the meropenem. Okay, so to summarize, septic shock, we start vancomycin and Zosyn. If they didn't improve, then we add vancomycin plus meropenem. We switch vancomycin to meropenem. If they didn't improve, we switch vancomycin to daptomycin, or based on the culture. And the other thing with septic shock, we want to remove all lines. The other thing is that we do blood culture daily until sterile, okay, until negative blood culture. So this is the septic shock. The other antibiotics that we can use to cover, so we said gram-positive, we can add another antibiotic, other options. We can use vancomycin for gram-positive, and we can use cefepime for gram-negative, and we can use metronidazole for anaerobes. So this is other option. So cefepime plus metronidazole equals Zosyn. That's one important thing. Another information that's very important, like, so piperacillin tazobactam, that's what the Zosyn. So the piperacillin tazobactam called Zosyn covered gram-negative plus anaerobe. The difference between Zosyn and Unicin, which is ampicillin sulbactam, Unicin have no pseudomonas coverage, while Zosyn have pseudomonas coverage. Another thing that you gotta pay attention to, that if there is a renal failure, for you want to calculate the creatinine clearance. Calculate creatinine clearance through MD-Calc, with MD-Calc, and then you go to Hopkins or Medscape to get the correct dose for antibiotics. This is for antibiotics that are renally excreted, like vancomycin, like meropenem and vancomycin. The other thing that we can do, vancomycin, we can do pulse. We do that a lot. Pulse dosing by pharmacy for vancomycin. The other thing that I learned is interesting, like for septic shock, like you can ask the nurse, what is the pressure support needed, the pressure requirement, is it getting better or not? So if a pressure requirement is getting better or not, if they're getting better, that means it's better, it means it's improving, responding to the antibiotic. And you monitor in the infectious labs in general, the one that you gotta look for, very important, white BC count, procal, you want to look at ESR, you look at the C-reactive protein, you look at the ferritin, you want to look at lactate dehydrogenase, and look at blood culture actually. Culture is very important. Culture for the wound, for the blood, but as second, actually first. This is very important. The culture is going to decide how to narrow down your antibiotics. So this is very important. And then the other thing, this very important thing that I learned, when there's septic shock or bacteremia, you gotta look for the source. Look for the source of infection. How do you look for that? You can do echo, and then you can do TEE for endocarditis, transesophageal echo for infective endocarditis. You gotta examine, full body exam, until you find the source. Once you find the source, then you do focus exam. And then the other thing that you want to do is that you want to do MRI too. MRI, CT scan. If somebody has abdominal pain, or if they have back pain, or if somebody's sedated, just MRI the whole thing. We had one patient had persistent bacteremia that we couldn't find out where is the infection. We examined him everywhere, every day, but we still couldn't find it. But then we did MRI the whole body. We found epidural abscess. Even if the MRI was negative and we couldn't find the source of infection, then we could have done the white BC scan, with fluorescent scan, which means they tag the white blood cell count and they see where they are mainly focused. That tells us where the source of infection. So this is very interesting. So that's the interesting part of the infectious diseases. The other thing that I learned is very interesting, like with COVID-19 management. COVID-19 management, usually the symptoms ranges from mild to moderate to severe to critical. Mild to moderate usually based on the pulse oxygen saturation. So if the oxygen saturation less than 94%, that's when it is severe, like patients coughing, having all these symptoms, shortness of breath. Initial symptoms can present with just headache, viral syndrome, aching, myalgia, these types of symptoms. But when it comes to severe, oxygen less than 94, or there's bilateral interstitial unfiltrated, that's a severe COVID. So what do you treat it with? You treat it with Decadron. That's important, showed improved in survival and decreased mortality. And you give low molecular weight heparin because it increases the COVID-19 increases the risk for thrombosis, so that's why we gotta anticoagulate them. Anticoagulation, heparin. The other thing that usually do is a convalescent plasma. So they add plasma. So, and usually with the severe, like usually the C-reactive protein can become more than 6. And you gotta look, one of the features of COVID is that lymphocytopenia. On CBC. And CBC with differentials. So they have lymphocytopenia, so gotta make sure. And pay attention if there is a procal elevated white BC more than usual. This is most likely bacterial. So you gotta pay attention to that too. And there is a mnemonic for the management of COVID-19. It's called MATCH+. MATCH+, which refer for methylprednisone, could be, we add ascorbic acid, we add thiamine, heparin, and plus like vitamin C, and give that anything that improve immunity. Zinc, we can add that. And they found out that Decadron actually decreases mortality by 1/3 in ventilated patient and by 1/5 in patient who's on oxygen. So that's pretty significant. So Decadron is something very important. The other thing, when do we give remdesivir? We give it when usually LFT more than 5 times normal and creatinine clearance more than 30. When somebody in shock and sepsis. Let me see. So to review COVID-19 management, remember match methylprednisone or Decadron, ascorbic acid for A, T-thiamine, match, no C, that's just MATH, H heparin plus the vitamin C or zinc. And the mainstay of remnant plasma is gonna get FDA approved soon, probably. Anticoagulation and Decadron. So for septic shock, you gotta do vancomycin, Zosyn. If it didn't improve, then you do change Zosyn to meropenem. If it didn't improve, then change that to daptomycin and plus meropenem. And patient with renal failure, consult pharmacy to do vancomycin dosing. And the main things we care about are infectious disease, white BC culture, procalcitonin, ESR, C-reactive protein, ferritin, and lactate dehydrogenase. And we reviewed the COVID-19 management. I tried to make this video short, so we'll discuss the other stuff in the other videos. Thank you so much for listening.